From the studio where it all began 10 years ago, where thousands of Americans have won more than $132 million. The show watched by billions of people all around the world. This is the return of Millionaire.
Welcome to Who Wants to Be a Pharmacist? I'm your host, Roger, and we have Dana here with us, who's going to be competing to become a pharmacist and also win $1 million. Let's get started. First question for $100. Which of the following is the website for the American Cancer Society? Is it A, cdc.gov, B, google.com, C, cancer.org, or D, bing.com?
C, cancer.org.
Final answer?
Yes.
Got it. On to question 2 for $200. Which of the following is the leading cause of lung cancer, causing nearly 9 out of 10 cases? Is it A, drinking alcohol, B, cigarette smoking, C, intravenous drug use, or D, asthma?
That's B, cigarette smoking.
Final answer?
Yes.
Of course it is. Question number 3 for $300. Which of the following nonprofit organizations' mission is to eliminate cancer as a major health problem through education, research, and advocacy? Is it A, American Cancer Society, B, American Heart Association, C, American Kidney Society, or D, American Infertility Association?
A, American Cancer Society.
Final answer?
Yes.
Right again. On to question 4 for $500. Which of the following is a type of treatment given by mouth or intravenously and is used in cycles to allow the body time to recover? Is it A, chemotherapy, B, electric shock therapy, C, psychotherapy, or D, occupational therapy?
That's A, chemotherapy.
Final answer?
Yes.
Got it. Question 5 for $1,000. Now if you get this one right, you at least walk away with $1,000.
Okay.
Which of the following is a type of cancer responsible for killing more people than the other 3 combined? Is it A, colon, B, breast, C, lung, or D, prostate?
That's going to be lung cancer.
Final answer?
Yes.
Computer, walk in C. Got it. You're at least walking away with $1,000.
Okay.
Question
Great.
6 for $2,000. Hair loss, nausea, and vomiting, mouth sores, increased chance of infection, fatigue, etc. can be described as A, benefits of chemotherapy, B, side effects of chemotherapy, C, chemotherapy overdose, or D, subtherapeutic effects.
That's going to be B, side effects of chemotherapy.
Final answer?
Yes.
Got it. Question 7 for $4,000. Which of the following are related to types of lung cancer? A, red and yellow, B, short-term and long-term, C, unilateral and bilateral, or D, small cell and non-small cell?
D, small cell and non.
Final answer?
That's my final answer.
You're breezing through them.
Yes.
Question 8 for $8,000. The spread of cancer is called A, translocation, B, progression, C, metastasis, or D, benign?
C, metastasis.
Final answer?
That's my final answer.
Confident this one is?
Yes.
Got it.
Yes.
9. Question 9 for $16,000. Which of the following types of treatment is used in early stages of lung cancer, especially non-small cell? Is it A, medication, B, surgery, C, physical therapy, or D, prayer?
B, surgery.
Are you sure?
I'm positive.
No prayer?
No.
Got it again.
Yes.
Question 10 for $32,000.
Okay.
Now if you get this one right, you're walking away with $32,000, regardless if you miss any more. So you better get this one right. From what area of the lungs do most lung cancers originate? Is it A, bronchi, B, trachea, C, bronchioles, or D, alveoli?
That's a hard one. But I believe it's A. Final answer.
Right again.
Yes.
Walking away with $32,000. On to question 11 for $64,000.
Okay.
Which of the following is not a major type of small cell lung cancer? Is it A, adenocarcinoma, B, squamous cell carcinoma, C, large cell carcinoma, or D, oat cell carcinoma?
D, oat cell carcinoma.
Sure?
Yes,
Final answer.
that's it.
Right again. Knows her stuff. Knows her stuff. Question 12 for $125,000.
Okay.
What percent of lung cancers are non-small cell? Is it A, 10 to 15%, B, 85 to 90%, C, 65 to 70%, or D, 35 to 40%?
B, 85 to 90%.
Just like that.
Yep,
Final answer?
yes.
Right again. Question 13 for $250,000. Which of the following is the most common site of metastasis in lung cancer? Is it A, liver, B, brain, C, bone, or D, soft tissue?
C, bone.
Final answer.
Yes.
Lock it in. You got it. On to the $500,000 question. For $500,000. Which of the following are newer drugs that are often used in conjugation with chemo or in cases where chemo is no longer working? Is it A, targeted therapies, B, toxic therapies, C, antibiotic therapies, or D, non-specific therapies?
I'd like to call my pharmacist Talia, please.
Okay, let's get her on the phone.
Hello?
Talia, Roger here from Who Wants to Be a Pharmacist.
Okay.
I have Dana here, and she is on the $500,000 question, and she needs your help.
Yay, Dana!
Talia, I need you. Here's the question. Which of the following are newer drugs that are often used in conjugation with chemo or in cases where chemo is no longer working? Is it targeted therapies, toxic therapies, antibiotic therapies, or non-specific therapies?
Okay, Dana, I would definitely have to go with targeted therapies. I would say I'm about 80% sure that's the right answer.
Are you sure? Are you sure, Talia?
I think so. About 80% sure. Targeted therapy.
Okay, I'm going with it. We're going on vacation if I win the money.
Okay.
Bye.
Bye.
Okay, targeted therapies.
Yes.
You're going to trust her.
Mm-hmm.
Lock it in. She was right.
Yes!
On to question
Good job,
15
Talia.
for $1 million, and you're right to become a pharmacist. The most commonly used lung cancer regimens include either of these two drugs. A, hydroxyurea or hydroxyzine, B, cyclophosphamide or mechlorethamine, C, bleomycin or mitomycin, or D, cisplatin or carboplatin.
Cisplatin or carboplatin?
Are you sure?
I'm
For
positive.
$1 million.
I'm positive.
Lock it in. You have just won!